glad to be on the channel, yeah.
Ben TV! And thank you for joining us on the program today. The program is Dialogue in Diaspora, coming to you live from our North London studio. My name is Tunde Alabi. This beautiful Monday morning, we hope you had a wonderful weekend. On the show today, we have some juicy guests in the house, 3-4 sessions, and we'll be going through almost every sphere of life, starting with the health sector. And my guest in the health sector will be talking about a very rare condition. Now, according to her, she said it's common. We'll be talking about fibromyalgia. Ever heard of that? Fibromyalgia. All right, we'll be talking about that health condition that is called fibromyalgia on the program today. And my guest is Ella Vine. Ella Vine is the Executive Officer of Fibromyalgia Action UK, and we'll be taking you through that. Then we also will be talking about UN Decade for African Descent, the challenges and the prospect. And my guests are the kind of special organization, IDPAD, in the advocacy of the UN Decade for African Descent. We'll be bringing you that in the course of this program. And also we'll be talking about women in leadership, and Harriet Kataba will be joining us in the program to talk about the role of women in leadership and upcoming program. Also, just a light show on this program talking about my story, music to be brought to us by Janjala in the course of this program. Just get a cup of tea, coffee, or whatever you enjoy. Draw to yourself a table and chair and enjoy the program at the appropriate time. We'll bring you. You'll be able to call into the studio and join the program today. Good morning. My name is Tunde Alabi. One more time, let me start with our first guest on the program today. Ella Vine, the Executive Officer of Fibromyalgia Action. Ella, thank you for joining us on the program today.
Thank you for having me today.
Fibromyalgia, that sounds very like I've never heard that before. Tell us, what is fibromyalgia?
Well, fibromyalgia, it's an incurable, chronic, widespread pain condition.
Take it easy. Incurable, widespread
in the whole of the body, yeah.
Pain
condition, but that's not just the only kind of definition, because it's not only pain, and I'm getting into this. Well, we use, and a common description of fibromyalgia is that this is a central nervous system sensitization syndrome, which is, I know it's very complicated, and I'm going to explain, which means that there is an amplification of the pain in the body.
So not just ordinary pain?
No, it's like an amplification of the pain of the body. But apart from the pain, and I'm getting into this, it's quite complex. It's really complex condition. So slowly, don't worry, I'll explain it. So it's the pain, but also another very common and disturbing symptom is fatigue, which is an extreme fatigue. It's a disabling fatigue. And there are lots of other common symptoms. For example, insomnia. So problems with sleep.
Finding it difficult to get out of bed or to sleep?
It's both. So the sleep problems would be different for different people. And another issue with fibromyalgia is that it's very individual. So there are not the same people with fibromyalgia who have exactly the same symptoms. They really vary to different degrees. But the insomnia would be that people having problem to go to sleep, and they may, after many hours, finally go to sleep at 3 a.m. in the morning, and then they may have difficulty waking up in the morning, or even when they wake up in the morning, and even if they have slept through the night, they will be exhausted, like they haven't slept at all. And some other symptoms will be bowel problems, so like IBS, irritable bowel syndrome, and also brain fog. So brain fog would be problems with concentration, memory difficulties like memory loss, having difficulty with finding the right words, forgetting things, like real. I've got it quite often. So problems basically with thinking, and there are some other conditions sometimes that go with fibromyalgia, so sometimes it is depression going together with fibromyalgia, but it's only sometimes, it's not always. and anxiety, and the other physical symptoms would be stiffness. Apart from the pain, could be stiffness, muscle stiffness, so people will have difficulties sit for a long time or stand for a long time. With the fatigue and the pain, it might be difficult for them to walk a lot, but if they sit for half an hour, they will be in pain by just that sitting, so it's very difficult to actually manage it and what to do.
So how is this actually different from ordinary pain or normal forgetfulness of people?
Yeah.
People forget things easily sometimes. But you're put to there quite a lot of symptoms that normally people do witness on some occasions.
I mean, in fibromyalgia, they can be severely disabling. Can be, don't have to be, because it's different stages for different people. But there's lots of people who live with fibromyalgia and are bedbound, for example, or have to use wheelchair. Or a housebound. It's really, really very, 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 very difficult and tough and disabling. In terms of the pain can be different type of pain for different people. So it could be like a muscle pain. So for example, imagine you've been working in a gym for many, many hours and then you're sore all over the body. That's the type of pain. Or it could be a pain like a tingling sensation. Often people will have restless leg syndrome, especially during at night with it. Which can be painful or not necessary, but the pain, because this is like a central nervous system disorder, the pain can be very erratic, and it could be feeling like maybe you had some electrical shock, or if your skin is burning all over. So it can be really different type of pain. Our logo of our charity, it's a butterfly, and it has two meaning. So one meaning is that we want to be free of fibromyalgia, but also the second meaning is that a slightest touch, like a butterfly touch, for a person with fibromyalgia could feel that like you have hit her or him with a hammer. So, and the pain can be much longer. So for example, if I will knock my elbow here, for a person with fibromyalgia, then the pain can be going on for all day, or 2 days, or the whole week, and then the pain can all spread all over, and the pain can start sometimes from one part of the body and it then spreads all over. It can, it's often a tension, muscle pain in the neck and upper back. This is quite often what people complain, but then basically it spreads all over the body, and it can be from the top of the head. People get headaches very often with fibromyalgia from the top of the head basically to the toes. Is
fibromyalgia known to the health authorities in the UK? Are they aware?
Yes, it is. Although not very well. Because of fibromyalgia, we still don't know what is the cause. The medicine did not find the exact, we can't pinpoint that A or B, it's
the cause of fibromyalgia.
But because we cannot show, and another one, I'll get to that with diagnosis, there is no diagnostic test that will show, like blood tests or other tests, that there is
the cause of fibromyalgia.
Yes, exactly. And because of that,
there's no medication for treatment.
There is some medication, and I'll get into that, what medication, to only ease symptoms, but you can't treat it to kind of completely cure. And this is only to ease the symptoms, which is very confusing because there's so many people suffering from it, up to 2.7 million people in the UK. Or
2.7 million people in the UK.
Yes, it's a very common condition.
Suffering from fibromyalgia.
Yes, well, this is so complicated and it's a lot to talk, so I'm just trying to explain it slowly. But in terms of the NHS, NHS is aware, although doctors like GPs and specialists with fibromyalgia, the specialists involved will be mainly rheumatologists, because fibromyalgia is classified within the musculoskeletal conditions spectrum. So all the arthritis type of conditions with musculoskeletal conditions, is over 200 different musculoskeletal conditions in kind of fibromyalgia. Because of the symptoms, not of the cause, sits within, but also neurologists are involved as well in the diagnosis. So neurologists and rheumatologists, they still need more education on that. In terms of the NHS, the GP, if we're talking about GPs have about 20 minutes in their curriculum to learn about musculoskeletal conditions like fibromyalgia, and this is not enough for them to understand a very complex condition that presents differently amongst different patients, and because of that, the average length of time to take to diagnose fibromyalgia, it's 7 to 8 years. That's the average. But we know lots of people who are diagnosed after 12 years, 20 years
of suffering from that condition,
and not being understood.
8 to 12 years to diagnose.
Yes. Sometimes, obviously, it's less. So, but this is very, very much postcode lottery. Whether a patient is lucky enough to find a doctor who understands this condition and who maybe had lots of patients before, was treating for fibromyalgia, then you might be lucky enough. It may take a year or less. But it is a lot of, on the patient side, lots of strength of keep going back to the doctors and keep asking, because the way to diagnose fibromyalgia, you have to first exclude all other conditions with similar symptoms. So, for example, thyroid disease, rheumatoid disease, and lots of other conditions that, like lupus, that will cause similar symptoms like fatigue-based and pain-based conditions. And once you diagnose it, it's all about talking with the patient and understanding the symptoms. So usually with the pain, widespread all over body pain, it's over 3 months. Then that's when the doctors will start, and all the blood tests, the mainly blood tests being done, are clear or don't show that this is the cause of the symptom is fibromyalgia. But often there are other conditions also present, which doesn't mean that person does not have fibromyalgia. So it could be different types of arthritis, for example, or other maybe autoimmune disease or even thyroid disease. But the fibromyalgia symptoms can kind of add to it. There will be more than just a thyroid.
Now let's talk about Fibromyalgia Action Group, your organization. What are you doing?
We are a very small national charity that has been run for the last 8 years, primarily by volunteers. I'm one of the first part-time employees, but we are still very small. And we provide support for people affected by fibromyalgia in the UK. So there will be people who live with fibromyalgia, their carers and their families. And we do that by providing information about fibromyalgia, which is evidence-based and objective, up-to-date information. We have the NHS information standard mark. We provide that information to patients, but also to healthcare professionals to raise their awareness. But also we provide direct information and support and signposting to patients, because lots of people with fibromyalgia have disabilities, so we also provide information and help with welfare and disability benefits and inquiries. But also we do lobbying and campaigning to improve the research and treatment and diagnosis of fibromyalgia in the UK. We work with lots of other organizations like Arthritis Research and lots of other working in the sector to improve the research and the treatment.
Okay, what are the chances of, or the degree of people of ethnic background, African, Caribbean, Asians, or Chinese in the UK contracting this condition?
We don't know. We really don't know. There is no research being done on this. It's really, really poor. I mean, we are kind of generally, like in Europe and in the UK, we are kind of getting to grasp this condition. Because 10 years ago, fibromyalgia was not widely recognized. And people, patients were thought of that, they are just moan, or they're just lazy, and often people are still being treated in that way because fibromyalgia is not widely understood. If we're talking about the research into fibromyalgia, there are bits and pieces being done in the UK and outside the UK, but they are on just different elements of fibromyalgia. Like right now, we work with the Sheffield Hallam University and Dr. Kim Lawson, who is the chair of our medical advisory board to our charity. At the moment, they are doing some research on fibromyalgia, but this is more like research into treatment of fibromyalgia. And it will take probably another couple of years or more for them, so this is still ongoing. There is another researcher, Professor Gary McFarlane, in the Aberdeen University in Scotland, who also does little parts of research on fibromyalgia, like the recent research was like alcohol and fibromyalgia, what is the kind of influence of each other. But this is like not enough, because it's such a complex condition that really involves lots of systems in the body. I just said about the central nervous system and the pain amplification, but also there are other systems in the body that are affected. So, for example, it could be metabolic because of the extreme fatigue that people are feeling, and the brain fog, the problems with concentration, but also the sleep disorder that comes with it. We know that like couple of little things in terms of the biochemical things that are happening in the body that we know. For example, people with fibromyalgia, that we know they have lower level of serotonin, which is the sleep hormone, and that may cause the mood disorder, not disorder, but like it can affect your mood, yes, exactly, and your sleep, but also you can feel the pain more because of that. And also we know that people with fibromyalgia have more of substance P in the spinal cord. Now, substance P is responsible for transferring pain messages. So that's what we know, but this is all what we know. There is not much more research done on it, like what can be done.
Why is research not being done? If it's a common disease affecting about 2.7 million people in the UK, and that's cutting across, why is the government or the NHS not putting enough money into research that would deal with fibromyalgia?
We will have to ask them, I think. But I think the
reason... How much
of
advocacy has the organization done? That's the Fibromyalgia Action Group. How much of advocacy have you done? Lobbying have you done with that? Are the MPs, GPs, or institutions or research organizations to ensure that the government and the NHS to put enough fund into this kind of this that is
for years
quickly growing?
I mean, for years. I've been involved with the charity for 3.5 years, but even years before, the trustees, the volunteers within the charity were talking to each subsequent government and to MPs and asking them to put some money into research or to improve the treatment for fibromyalgia, and that never ever been done anything. I mean, none of the government so far put any penny into fibromyalgia, to do anything with fibromyalgia yet. But now I think we are starting seeing some slight changes, and I'm feeling quite positive about it. And I think you have to be positive about this subject. You know, if you have to have hope for the change, because with the current government, we have involved the MPs. We have written to all the MPs, and now there are 23 MPs who are fibromyalgia ambassadors. 23 from all different regions like Scotland, Wales, England, and from all different parties. And but they are mainly involved in their local constituency. There's lots of local fibromyalgia support groups.
Are they enough to bring these conditions to the attention of the government? Are they doing enough? These 23 MP ambassadors of fibromyalgia, are they doing enough to ensure that this condition is brought to the attention of the government and the government act on it?
What we did in May, there is a International Fibromyalgia Awareness Day every May. So we did an event in the Parliament, and we invited all the fibromyalgia ambassadors, but we invited all the MPs, as well as we invited Jeremy Hunt, the Health Secretary, to attend. Jeremy Hunt did not attend, unfortunately, although he sent an apology. So this was the first time ever where we actually had some kind of like email conversation with the health minister for the first time, and we brought this meeting, this event on fibromyalgia for the first time for the attention to the health minister, because before there was basically no interest and no engagement on that. So we're kind of getting into that, and I think what it was that perhaps Jeremy Hunt was interested and wanted to attend, but because there was no history of health ministers or like, you know, the Department of Health being actively involved or actually showing an interest, you know, because when we talk to ministers...
Why would they not show interest in
what
the
I'm
condition
saying
that's
is
affecting about 2.7 million people?
I don't know, we've got to ask them, but because we talk to ministers and we talk to MPs about it every single time, whatever you try to mention to them, they will say there is no money. You know, that is it. And I think what it could be is that, for example, the Department of Health and Jeremy Hunt, he maybe have been interested, but he knows if he will show too much interest, you know, he will have to put some money into that. And if they, I don't know what's going on, you know, inside the government, but they're probably all fighting. Each department is fighting for money. Within the Department of Health, they will be fighting amongst all the conditions and where to put the money. It's very hard to do that, but we keep doing it. So starting with raising the interest, but trying to do it in a positive way, so that they will see that there is hope. To start off that there is hope, if we'll do a little bit more research, we'll get to know more about the conditions, so we will be able, firstly, better and quicker diagnose patients and tailor the treatments that are, you know, appropriate for fibromyalgia.
Quickly before I let you go, do you have an idea of this condition? Which is it common, prevalent in amongst men or women? Or do you know how it operates?
It's both. I mean, there is a common misconception that fibromyalgia is women or women mainly. No, I mean, there is more women diagnosed with fibromyalgia, but there is lots of men diagnosed as well. The ratio is like as twice as more women as men are diagnosed, but we're talking about the diagnosis. Now, there is many people who are not diagnosed with fibromyalgia, and we don't know why it is, whether this is something biochemical in the body that causes more women to have fibromyalgia, or it might be like a cultural issue where men are maybe less likely to go to the doctor and complain of a pain. In the past, like this is still being used to diagnose patients. Apart from talking about the history of the condition, there are like 18 tender points in the body, like on the back of the neck and the back and lower back and on the legs, where the doctor will press, and if a person will say it's painful, and 11 of those points, of the 18 points, that will be diagnosed fibromyalgia. Now we are getting away from it, which is, I think, good, but we think that maybe because of the way the fibromyalgia was diagnosed before, pressing, like light press on the body, men maybe would be less likely to say, oh, and this is painful. So we don't really know why, but what is very important to understand, are men also suffering from it and suffering badly, and also children, very young children.
Let's quickly come to your organization. Give us more details about your organization, in case my viewers watching this program, if they do know somebody who is suffering from fibromyalgia, or they themselves are suffering from fibromyalgia and they've not been able to talk to somebody, or the condition actually looks like, people don't understand it, how can they contact your organization? Where is your office, like a phone number?
You can go on our website, which is www.fmauk.org. So because Fibromyalgia Action UK, FMA UK, FMA UK.org. So www.fmauk.org.
Okay, great. Or if they just Google fibromyalgia,
Action UK, yes.
Action UK. All right, what's your office?
Well, our head office is in Scotland, near Glasgow.
All right, fantastic. Before I let you go, quickly tell us, at the moment, you have no idea how much government is putting or plan to put into research?
No, nothing at all whatsoever. We haven't been told anything. As far as we know, there is no plans so far to do anything about that from the government side. And
you also do not have an idea which set of people in the UK this affects more, maybe the black or the white, the Caucasian,
we don't know.
Caribbean?
We don't know. There was no research done on it.
And also no idea about maybe is a condition more to the women or to the men?
Well, we know that there were more women diagnosed more than men.
So but it's likely again, that men
there needs to be. We don't know. We don't want to say that because it actually might be something happening in the body of the person that causes more pain and fatigue and just all the symptoms. But again, we just don't know. There is not enough research being done on this.
Okay, quickly before I let you go, quickly tell us the symptoms of fibromyalgia again.
So it's widespread all body pain and extreme fatigue, insomnia, bowel problems like irritable bowel syndrome. Often it's low mood and it can come with depression, but other symptoms will be like stiffness, muscle tenderness, restless leg syndrome. So there's the whole spectrum that go together and can be really extremely disabling. It can make person bedbound.
Ella, thank you for joining us on the show, and thank you for trying to inform our viewers about fibromyalgia on the show today. We look forward to having you again. We'll talk about this condition and until the government begins to do something about it. Thank you, Ella Vine. Thank you for coming on the show.
Thank you very much.
All right, we're going on a short break, and I'll bring in my next guest to the program. Don't go away. We'll stay on live here, Dialogue in Diaspora, from a Ben Television studio, North London.
Now showing on Ben TV Sky 182 every Saturday at 10 a.m. and Sundays at